do know that there are some places and some cities and states across the country that are beginning to open. And one of the things that people like yourself would like is for salt therapy providers, people that really have halotherapy facilities, to be somewhat, deemed as essential in terms of the things that you're talking about, being able to provide salt therapy treatments to local healthcare providers, to first responders. We've been working with other providers across the country in different circumstances where some are even looking at how they can be a resource for people that are recovering from COVID and being part of some clinical studies, as well as looking at how salt therapy may be related to being more of a preventive type of a treatment.
Exactly.
So I spoke with a infectious disease doctor yesterday or on Saturday with Dr. Penn.
Excellent.
That will soon be talking a little bit about the types of studies that he's looking at doing. But as a respiratory therapist, what are your views about how are you using this now that you and your husband have had COVID, how this could be used as a rehab or a recovery mechanism?
I believe it's an excellent step to consider the salt therapy essential. Why? Because after you get hit with a virus like that in the lungs, I experienced it. It's nothing I ever seen in my line of duty neither. As I was experiencing the crisis, I just kept thinking, how am I going to treat this? It was just gasping for air. My lungs felt like they were squeezed and they were tight. And it was just devastating. I believe that post-treatment, as a complementary, it will be absolutely beneficial. I'm being benefit myself. I have the luxury that my facility is actually home-based. So I have a room right here. You bet that before I go to work sometimes or after, depend how the time is, I do my salt therapy. And it's a given. Like I say, it really hydrates my upper sinus cavity. And I, in the hospital, actually nebulize normal saline in another way. We do fluid. We put it on the medication along with the bronchodilators, and we do it as a nebulizer. So because
you're making reference to the hypertonic saline solution?
The hypertonic saline solution. So because a study been done that yes, it's very good for brake secretion. It helped control bacteria that cause pneumonia. And therefore, with the salt, it decreases the aggravancy of the pneumonia. It also helps to expectorate because as a hypertonic it's binded to the receptor sites and it helps to mobilize the secretion. That is one of the reasons that it also works well with cystic fibrosis. Yeah. I believe that a study needs to be done, and I wish so that it comes to it, to see how will the salt therapy pertaining to the virus, especially to COVID, it will help. Because in my opinion, I think it will.
Yeah, right now, as I mentioned, there is a infectious disease physician who's looking at working.
That's excellent.
With a university under his guidance. He's looking at a few of the research students that are in school right now to enroll them in looking at this. And so obviously there's the quality of life type of measures that you're talking about and how it's impacting. But I think it will be valuable to somehow look at certain indicators and how dry salt therapy, similar to how there's been studies on hypertonic saline solutions. I know that Dr. Laish, one of the founding board members of the Salt Therapy Association, has done some of his own preliminary pilot studies, has written about it. He does a lot of work with people with cystic fibrosis. A lot of the mechanics that are in our certified halotherapist program, both in module 2 and the recent module 3 that was just launched this weekend, really point to a lot of the hypothesis about the efficacy of dry salt therapy, not wet salt therapy.
No, the dry.
Yeah.
So it's the idea that, yes, it's being studied and it's proven that salt does help the respiratory system, especially the lungs, the upper respiratory, and the lower part, which is the lungs. Yeah. So that's why I believe that we need to make studies doing it and make it out there dry salt therapy. Maybe we can bring it to Congress. Maybe they can see if we can consider it essential. I believe that it will be a great help to the community if we can provide it, especially now. We really need to be giving it to the community, but yet we're close because it's not considered essential. So that was a little bit harsh, realizing that I know I can help and then I cannot provide it. I'm lucky because I can do it because I'm here and I seen the benefits. Yeah. I see the benefits. So it's important to do studies and bring it out there